The Lok Sabha elections are here and the climate in India is hot. It's literally hot. I mean both because of the political discussions and the scorching sun's heat. Several hundreds of people have lost their lives because of heat exhaustion, sunburns and severe dehydration. And you will be suffering from many diseases too. Hypertension, high blood pressure, cardiac diseases, stroke, diabetes, and you will be taking medicines for all those conditions too. You will be thinking that you can stay at their home and not go out for campaigns and cast your vote, right? I'm Dr. Prasoon. I'll be telling you some easy to follow health tips so that you can go out for the campaigns, cast your vote, do your public citizen's duty, and that too without fearing all these complications that I already mentioned. So let's get started. Everything goes well if it has been planned. You know the dates of the election. It has already been published. Mark those dates on your calendar, whether you're going out for campaign or for casting your vote. Plan it well in advance. Apply for leave. Plan the hours in such a way that you never go out in the sun between 11 a.m. and 3 p.m. Trust me on this one. You will thank me later. Now let me tell you about heat exhaustion and heat stroke. Heat exhaustion happens when your body is exposed to prolonged heat. What happens is that there will be profuse sweating, as a result of which your body blood volume decreases, blood pressure decreases, you will feel lightheadedness, headache, nausea, vomiting. But the mental state of the patient is unaltered. If heat exhaustion is not treated, it can lead to heat stroke, which is actually a much dangerous situation to deal with. In heat stroke, there will be the symptoms of heat exhaustion, and in addition to that, the mental state of the patient will be altered. He will be confused, he can be delirious, sometimes he will be even unconscious, and heat stroke can even lead to death. Now talking about the risk factors of heat stroke, elderly people and children are at much higher risk of heat stroke. Those who do not drink sufficient amount of water daily are at higher risk. Persons who are suffering from diseases, heart diseases and lung diseases are at higher risk. Persons who are taking medicines, certain medicines like blood pressure lowering medicines, diuretics, which are medicines that are used to flush out the fluid from your body, antipsychotics, antidepressants are at much higher risk of heat stroke. So now you know what heat exhaustion and heat stroke is. So what should you do if you are suspecting symptoms of heat exhaustion, and if you find that someone is going into heat stroke, what should you do? First of all, take the patient indoors. Remove his clothes if possible. If they are tightly fit, remove it and apply cold water on his body. If ice packs are available, it will be better. Apply cold water or ice packs in his armpits, on the side of his neck and his groin area. Why these areas? Because large veins in our body run close to the skin surface in these areas, and if we apply cold there, blood will become cooled easily. So in addition to that, offer him water to drink. If the patient's condition is not improving in 30 minutes, it will be better to take him to a hospital where he can receive emergency care. So now what should you do on the day when you're actually going out, whether it will be for campaigning or for casting your vote? I'll tell you certain things that you should follow. First of all, choose light colored, lightweight and loose fitting clothes. Second, take all the medicines that you are already taking, medicines that you are taking on a daily basis. Do not skip the medicines unless your doctor has advised you to. Don't take the medicines together, 2 doses of a medicine together, just because that you forgot to take in earlier dose. If you have a latest prescription of all the medicines that you're taking, carry it with you. Keep it folded in your pocket or wallet. Take a bottle of water and drink it as frequently as you can, unless you have been diagnosed with a chronic kidney condition, in which case your doctor will have set a limit on the amount of water that you can drink daily. Take an umbrella and make sure that you use it, particularly when you're out in the sun between 11 a.m. and 3 p.m. And do not leave your children in parked vehicle out in the sun. So that's it. I hope you like this video. If you like this video, don't forget to like, comment and share. If you have more doubts about heat exhaustion and heat stroke, you can visit dofoodie.com or install our app from the Google Play Store. Doctors are waiting there to answer your questions. So until I see you in the next video, it's me, Dr. Prasoon, signing off. Stay healthy. Bye.